So, immune system. So we should look at strengthening our immune system, and in order to do that, let's try to understand where the immune system is. Where is it? So far, any questions? Anything? Everything clear? Yes?
What you mentioned about allergies, so you're saying that was a hyperactive system?
What's the outside world? You're overreacting to something someone else who doesn't have an allergy doesn't react to. And it's just for no advantage. Why does someone react to house dust? And 80% of the population doesn't. It only causes you, misery.
But it can affect your internal system.
Well, there's actually statistics. People have significant allergies have higher cancer rate. So nothing totally. If you have chronic inflammation, allergy means your system is turned on, chronically inflamed. That's not a good thing in medicine. Okay? We like acute inflammation. We like people to get sick, and a week later it's over. That's how it should be. We don't like people to have chronically low-grade inflammation all the time, or an infection they don't get rid of, or dental infection they don't get rid of. That's not healthy, because that's not what the body is made for, and we're not handling that very well. Because it turns on the defense, but the defense is never able to overcome it, and then you have constant inflammation, and that means your system runs red hot and burns itself out at a certain point, and does funny things. Yes?
What about if you have both internal and out, the external attacking your body?
Right, well, you have to do whatever you can do to strengthen that. Many people do have allergies and have frequent infections, comes with it. For example, have autoimmune diseases, God forbid have cancer, so that's just a scenario. So keeping our immune system unburdened so that it can do what it actually is doing in such an excellent way. Do you see what I'm saying? So it's just this distinction that there's nothing wrong with your immune system. I mean, there's a few diseases, where every organ, every system of the body can be diseased. And some kids, have to be in intensive care unit and in a sterile environment, otherwise they lack certain immune functions. But it's extremely rare. Most of it is due to us and our lifestyle, what we're doing.
What about hyperbaric oxygen?
Well, hyperbaric oxygen just presses more oxygen into your system, not free radical oxygen, not radical oxygen. Not hydroxide, which is good because you get more oxygen into wherever it is you need to get oxygen into. And that's healthy for you. Yes?
If you just eat vegetables and fruit, is that bad?
Say it again?
If you just eat vegetables and fruit, but
no, it's lovely. It's great.
But you don't eat any meat anymore, then what do? You have to have the protein in your diet?
If you only eat vegetables and fruit, you will, after 2, 3, 4, 5, 6 weeks, have a protein deficiency. You're going to be tired. Your immune system is going to be weak. You're not going to be your optimal self. It depends on many factors. You're going to lose muscle mass because your body needs protein. Your immune system needs amino acids to function. You take it out of your muscles. You see, many vegetarians don't have a lot of muscles. They're able to gain muscle. Not a healthy thing. That doesn't mean vegetarianism is bad. You have to do it right. You don't take all these animal toxins in which we get. The fertilizers and antibiotic residues and hormone residues and what have you. So in general it's good, but you have to have enough protein. It's profound. And I can't tell you how often I see vegetarians who are not optimal, and I don't have a stake in this whole thing, Yes?
How does the hormone level influence the immune system? Is there a correlation?
There's a correlation. If your hormones go down, your immune system gets weaker. Young people, often have a powerful immune system. You can send them into wars, you can, have them go through pregnancies, you have to go through stress, go through medical residency, you just take it, You don't sleep, you just take it. You have a powerful immune system. So once your adrenal hormones go down, your DHEA goes down, your pregnenolone goes down, once your sex hormones go down, you're going to be more susceptible. By trying to stimulate if you can, try to substitute if you can't. Compensating with other things. Not living, not partying through the night, not drinking tons of alcohol, having a more reasonable lifestyle. But your hormonal system will not be so strong. Your immune system will not be so strong. It's a fact. Yeah, it's called immune senescence. Immune system ages. Yeah, and often people do get cancer suddenly because the surveillance is not happening. You know, in the 80s and 90s, thank God, these are slow-growing cancers, and they normally don't really kill people. Yeah, unless a doctor prescribes them chemotherapy. You know, and that kills them. Sadly enough, very late in life. Very late in life. Yeah, I'm not talking about earlier. Slow-growing cancers because our own immune system breaks down. And then you have to know what stands between you and an optimal immune system. Do you eat optimally? Do you have good stress management? Do you take some antioxidants? Do you exercise regularly? I don't really go into that too much. Exercise, immune stimulative. Running Ironmans, damaging to the immune system, obviously. Yeah? High athletic sports is a lousy deal. Yeah? I mean, number one, you create cripples in people in the 50s, 60s, early 40s, 50s, 60s, need all kinds of replacement. And secondly, it's not good for the immune system. You know? And it's a short fame and lots of money, but long term, not healthy. Yeah? And not sleeping, obviously, is so, you know. So you have to know what are the factors that play into it. Yes?
Calcium supplements. I saw an ad on TV recently about time-release calcium. Is that, have you seen that? Have you heard of that?
Yeah, but it's...
effective?
Yeah, I mean, time release is fine. In general, it's not a bad idea. But calcium, if you take calcium 2 or 3 times a day, you do the same thing, you know. And then you have to be aware that everything that's time released has something that prevents it from releasing fast. And what is that something?
Yeah.
You see, that
Yeah.
often is a chemical. If you're very lucky, it's beeswax, and it's baked into the beeswax matrix and releases it slow. You know.
Maybe just take it a couple
And
times.
otherwise, I would prefer as clean a product as possible and not something that's highly constructed. Yeah? Just like with eating, we should eat clean and from nature and not highly artificially prepared foods, designer foods. Sounds great, it's lousy.
You
Yes.
said water-soluble supplements you should take more than
Twice
once
a day.
That's vitamin C.
Vitamin
What
C.
else?
Vitamin C, beta-carotene, B vitamins, minerals, all going to go. Yeah? So you should take a multi twice a day, ideally.
Yeah.
If you're very healthy, you know, take it once a day, who cares? But if you have something twice a day, or potentially even 3 times a day. Yeah. Yes?
Doctor, you discussed of toxins. What about fluoride in water?
Well, this is a whole other. Did you have to bring that up? Yeah. Fluoride is a toxin, is an industrial end product, and to put that into the drinking water of everybody is ridiculous. You know, there's a much better ways if we would switch away from our whole high sugar consumption and, you know, teach our kids to eat more healthily would be a significantly better way. You know? I mean, everything you put into public water, there's enough crap in our public water already as it is, you know, from parasites to heavy metals to toxins to chemicals to whatever. You know, it's just frightening. And drinking clean water, molto importante for your immune system. Okay? So my trick,
Is that
yes.
in bottled water?
Bottled water, yeah.
Bottled?
Plastic bottled water which you keep in your warm car. I recommend.
Yeah, right.
Distilled water.
What?
Distilled water.
Distilled water we don't like because it's mineral depleted. Yeah? So if you replenish it, osmosis water, reverse osmosis water is great, but you have to put a little bit of electrolytes in it. Yeah? The old idea of drinking soft water is actually not healthy because you deplete it of minerals.
You've taken that have damaged, you might have damaged you.
Say it again?
Medicines that you've taken orally
Yeah.
that might have damaged
Yeah.
you. How do you get them out of your
Well, you
system?
detox it the normal way your body does it. You make sure your detox organs are open, you're not constipated. You know, you activate your bowels, vitamin C flush, for example, take high dose vitamin C, that activates your bowels, or take fiber, binds toxins. You activate your liver, to serve various herbs and supplements and amino acids, which activate your liver detoxification. You sweat, you go in a sauna, infrared sauna, a hot sauna, drink lots of water, sweat, you exercise, sweat it out through your skin, you do blood cleansing, you pray, and you hope for the best.
Is wine bad for your
Something like
teeth too?
prednisone.
Sorry, what?
What's the time frame for something like
Well, it depends. I mean, some people are chemically sensitive. See, sometimes drugs activate the immune system. It's not, I mean, there's a whole world out there which we don't know. You know, someone starts a new drug, and then 3 months later they get joint achiness. Then they get the second drug for the joint achiness. Actually, the joint achiness is due to the fact that the immune system was reacting to the first drug. Yeah, and inflammation is one of the, it's very complex, you know. So in general, I don't want to knock drugs, they're essential, you know, for many people, but we're certainly overusing them. Yeah, in America, 50% of world production of drugs is close to 50% is used in America, 50%.